You know those moments when your body does something totally out of the blue, something that makes you stop and think, huh, what was that all about?
Yeah, like a weird noise or feeling you just weren't expecting.
Exactly. Well, today on the deep dive, we're tackling a topic that might bring up that exact feeling for some listeners: vaginal gas.
That's right. It's one of those things that isn't often talked about openly, but based on what we've been looking into, understanding what it is and why it happens, is actually, well, it's pretty important for your overall vaginal well-being.
Okay, so vaginal gas. For anyone who's maybe never really thought about it, what exactly is happening? What are we talking about here?
So in simple terms, vaginal gas is just the release of air that has somehow gotten trapped inside the vagina.
Trapped air, okay.
Yeah, and the sensation, maybe sometimes the sound, it can feel a bit similar to, passing gas normally.
Right, that sudden puff of air can feel a little unexpected, I guess. And I think the immediate question most people probably have is, wait, is that normal? Should that be happening?
And that's a totally valid question. Look, experiencing it occasionally, usually nothing to worry about. Often it's just air that got in temporarily and is now getting out.
Okay.
But if it's happening frequently, like all the time or very persistently, our sources indicate that could be a sign something else might be going on under the surface.
Okay. So that persistence is key.
Exactly.
Yeah.
And that's really what we wanted to explore today. We've been digging into information that helps explain the potential causes, how it can affect your vaginal health, and importantly, what you can actually do about it.
Great. So let's get into the why then. What are some of the main reasons air might end up getting trapped in the vagina?
Well, our sources point to a few significant possibilities. One of the more noteworthy factors can be the development of something called fistulas.
Fistulas. Okay, that sounds a bit medical. Can you break that down for us?
Absolutely. So a fistula is basically an abnormal connection. It's like a little tunnel that forms between two internal parts of the body that shouldn't normally be connected. Now, when we're talking about vaginal gas, we often mean either a rectovaginal fistula, that's an opening between the vagina and the rectum,
Right.
or a vesicovaginal fistula, which is an opening between the vagina and the bladder.
I see.
And unfortunately, these connections can allow air or gas or even fluids like urine or stool to pass from one place to the other
Right.
and then eventually come out through the vagina.
Oh, wow.
Yeah. So that leads to that recurring vaginal gas. The key insight here is that persistent vaginal gas, especially if it comes along with, say, leakage of stool or urine, that's a really big red flag.
Definitely sounds like it.
It strongly suggests a potential fistula, and that absolutely needs medical attention to figure out what's going on.
Yeah, that certainly sounds like something you'd need a doctor for, no question. What about other reasons? Maybe things that are a bit less critical.
Another area our sources highlight is related to surgery, specifically pelvic surgeries.
Like hysterectomies.
Exactly, hysterectomies, or surgeries to repair pelvic organ prolapse. These procedures can sometimes change the anatomy of the vagina a bit,
Okay.
and this altered structure might just make it easier for air to get trapped temporarily inside the vaginal canal. And in some cases, though it's less common, the surgery itself could inadvertently, contribute to a fistula developing later.
Okay.
So it's definitely something to be aware of during recovery after those kinds of operations.
That makes sense. The body's healing and adjusting. What about causes linked more to just natural body changes over time?
Yeah, weakening of the vaginal walls can also play a role. Factors like childbirth or just the natural aging process can cause the muscles and tissues there to lose some tone, some elasticity.
Right.
Think of it like maybe a less snug seal. If there are slight gaps or looser tissue, air can get in and out more easily.
That's a helpful way to picture it. Less support, maybe?
Kinda, yeah. This weakening can increase the chance of air getting trapped and then released.
Okay. And what about just everyday stuff? Normal activities?
Yes, definitely. Sources mention things like yoga poses, sexual intercourse, even just really strenuous exercise can introduce air into the vagina.
Right. I think many people have probably experienced that.
Exactly. And usually that's totally fine. Not a concern. The air just comes out naturally, maybe infrequently. But the caveat is if you find it's happening really frequently, even with these normal activities,
Right.
it might still be worth considering if there's an underlying factor making it happen more often.
Good point. So even the normal causes could point to something else if it's excessive.
Potentially, yeah. It's about the frequency and persistence.
Okay. So we've covered what it is and some of the reasons why it happens. Now let's talk about the impact. It's not just about the sound or the surprise, is it?
No, definitely not. Persistent vaginal gas, especially when it's linked to something like a fistula, can unfortunately create a pathway for, well, for harmful bacteria to travel into the vagina.
Oh,
And
yeah.
that can seriously disrupt the delicate and really crucial balance of the vaginal microbiome.
The microbiome. Okay, for listeners who might not know, why is that balance so important? What does it actually do?
So the vaginal microbiome, when it's healthy, is dominated by beneficial bacteria,
Mm.
mainly types called lactobacilli.
Lactobacilli, right?
These amazing little guys produce lactic acid, and that lactic acid makes the vagina acidic. It keeps the pH low.
Okay.
This acidic environment is like a natural defense shield. It stops other potentially harmful microbes from overgrowing.
It's a security system.
Exactly, a very effective one. Now, when that balance gets thrown off, maybe bacteria get introduced through a fistula, or maybe there are structural changes after surgery that affect things. It creates an opening.
An opportunity for bad stuff.
Precisely. It makes it easier for conditions like bacterial vaginosis,
Yeah.
BV, or urinary tract infections, UTIs, or yeast infections to take hold. The body's natural security gets compromised.
That makes perfect sense. It's all connected, isn't it?
Very much so.
And you mentioned fistulas and surgeries specifically disrupting this. How does that work?
Well, imagine that protective barrier of lactobacilli being constantly bombarded by microbes coming from, say, the rectum through a fistula.
Yeah.
Or think about how changes in the vagina's shape or structure after surgery might affect airflow or even just the normal shedding of cells. All these things can influence which microbes thrive.
Right. Changes the whole environment down there.
It does. It makes it harder for the good bacteria to do their job and keep that pH low. Plus, the constant passage of air, or maybe other fluids if there's a fistula, can also just directly irritate the vaginal tissues, leading to inflammation, redness, discomfort.
Oh, yeah. That sounds unpleasant.
It can be.
Hmm.
And beyond the direct physical health impacts, our sources also touched on the emotional side of this.
I can definitely imagine dealing with recurrent vaginal gas could be pretty distressing.
Absolutely.
Yeah.
Experiencing, especially, in social settings or during intimate moments, it can unfortunately lead to feelings of embarrassment, significant anxiety, even real distress.
Yeah.
It can genuinely impact a person's quality of life and their self-confidence. It's not something to be easily dismissed.
No, definitely not. So it's a clear that addressing persistent vaginal gas isn't just about physical comfort, it's about emotional well-being too. Let's move on to what can actually be done. What are the key strategies for restoring and maintaining good vaginal health in these situations?
Okay, the first and honestly the most critical step, if you're experiencing persistent vaginal gas, especially if it comes with other symptoms like unusual discharge, any pain, maybe an odor, you need to talk to a healthcare provider.
Number one, talk to a doctor.
Absolutely. They're the best resource to figure out what's really going on. Diagnosis might involve imaging tests or physical exams to see if there's a fistula or other structural issues. Getting that accurate diagnosis early is key.
That makes total sense. Early diagnosis is always crucial. What about if surgery was the context? What's important post-op?
Adhering really closely to your surgeon's specific advice for recovery is vital.
Following instructions to the letter.
Pretty much, yeah. That means careful wound care, respecting activity restrictions like no heavy lifting too soon, and just being really vigilant, watching for any signs of complications. That careful recovery period helps minimize risks like a fistula forming or other issues popping up.
Right, giving your body the best chance to heal properly. And what about just everyday hygiene? Anything specific people should do or maybe not do?
Gentle hygiene is the way to go. Our sources recommend using mild pH-balanced cleansers and only on the external area.
Not inside.
Definitely not inside. And importantly, it's generally advised to avoid douching altogether.
Oh, right. Why is douching bad in this context?
Well, douching can really disrupt that natural, delicate balance of bacteria inside the vagina. It washes away the good stuff along with anything else, potentially making things worse.
Okay, good to know. So gentle external washing, avoid douching. Are there any broader lifestyle things that help?
Yes, the basics still apply. Staying well hydrated, drinking enough water, and eating a good nutrient-dense diet. Lots of vitamins, antioxidants, fiber that supports your overall health, including tissue health and healing everywhere in your body.
Makes sense. And I know pelvic floor exercises, Kegels, often come up for vaginal health. Do they play a role here?
They certainly can be beneficial, yeah. Kegels help strengthen the pelvic floor muscles, which support the vagina.
Okay.
Stronger muscles can provide better support to the vaginal walls, and that might potentially reduce how much air gets trapped. It's about improving that overall tone and support.
So potentially helpful as part of the picture.
Exactly.
Okay, those are some really important practical steps. Our sources also put quite a bit of emphasis on probiotics for vaginal health. Can you tell us more about that?
Yeah, probiotics can be incredibly valuable allies here, especially when the vaginal environment has been disrupted, maybe by a fistula, surgery, or infections.
How do they help? Exactly.
Their main job is to replenish those beneficial lactobacilli bacteria we talked about earlier.
Bringing back the good guys.
Precisely. By boosting the numbers of these good bacteria, probiotics help restore and maintain that crucial acidic pH level. And that, in turn, makes it much harder for harmful microbes to get a foothold and cause problems like BV or yeast infections.
So they help reestablish that natural defense.
Yes, exactly. They help create a protective barrier, essentially. Plus, some research suggests probiotics can also help modulate the local immune response in the vagina.
What does that mean?
It means they might help calm down inflammation and support tissue healing. A balanced microbiome, which probiotics can support, really boosts the overall health and resilience of the vaginal tissues. That's super helpful during recovery or when dealing with irritation.
Okay, that all makes a lot of sense. Now, our sources specifically mentioned a product, Balance Complex, as an example of a comprehensive vaginal probiotic. What can you tell us about why something like that might be relevant here?
Right, Balance Complex was presented as a vaginal probiotic specifically formulated to tackle some of these challenges, like issues following fistulas, surgeries, or just general microbial imbalances.
So, targeted support?
Kind of, yeah. It's described as having a comprehensive approach. The goal isn't just restoring microbial balance, but also helping reduce inflammation and supporting long-term vaginal health. The idea being, when things are complex, like after surgery or with a fistula involved, a multi-pronged approach might be more effective.
It sounds like it's designed to hit the problem from a few different angles then. Can you give us a sense of the main types of ingredients in it and what they do without listing every single one?
Sure. So at its core, you've got a blend of different lactobacillus strains. Those are the key probiotics for reestablishing the healthy microbiome and that protective acidic pH.
The core probiotic function.
Exactly. Then, beyond just the probiotics, it often includes ingredients like cranberry and D-mannose. Those are well known for helping prevent bacteria, especially E. coli, which causes UTIs, from sticking to the walls of the urinary tract and maybe the vagina too.
So, helping prevent infections that way.
Right. And then you might find natural antimicrobial agents like oregano leaf extract or caprylic acid. These can help fight off harmful bacteria or yeast, but hopefully without wiping out all the good bacteria.
A more targeted approach.
Potentially, yeah. Some formulas also add enzymes like protease and cellulase. These can help break down biofilm.
Biofilms.
Yeah, they're like these protective slimy layers that some bacteria build around themselves, making them harder to get rid of. Enzymes can help disrupt those.
Interesting.
And finally, you often see soothing ingredients like aloe vera or immune-supporting ones like arabinogalactin, maybe even things like reishi mushroom for inflammation. They aim to calm irritation, reduce inflammation, and support the tissue health itself.
Wow, okay. So it really is a mix. Probiotics for balance, anti-adhesion stuff, antimicrobials, biofilm busters, and soothing healing ingredients.
That's a good summary, yeah. It's trying to cover multiple bases relevant to the issues we've been discussing: microbial balance, infection prevention, inflammation, and tissue health.
That's a really helpful way to understand that kind of products approach. It's not just one thing. Now, our sources also briefly mention a website, vaginalquiz.com. What's the deal with that?
Ah, yes. Vaginalquiz.com was presented as a tool women could use to get a more personalized handle on their vaginal health.
Like an online assessment.
Sort of. It's described as a quick, science-backed quiz. You answer questions about symptoms, lifestyle, that kind of thing, and it aims to help identify potential imbalances.
And then what?
And then it offers expert-backed suggestions tailored to your situation. The idea is to give an accessible first step for women who are having issues or just want to be proactive about their vaginal health.
Exactly. It's positioned as a way to get some initial insights and maybe some guidance, without necessarily having to run straight to the doctor. Although it's super important to remember, online quizzes are not a substitute for professional medical advice if you have real or persistent concerns.
Absolutely. A tool, not a diagnosis.
Precisely.
Okay, great. So as we bring this deep dive to a close,
Yeah.
what would you say is the most important takeaway for our listeners about vaginal gas?
I think the key thing is occasional vaginal gas. Probably fine. But if it's happening frequently, or if it comes with other symptoms that worry you, discharge, pain, odor, leakage, Don't ignore it. It's definitely worth talking to a healthcare professional because it could be a sign of an underlying issue that needs addressing. And more broadly, just remember that maintaining a healthy, balanced vaginal microbiome is so, so crucial for overall vaginal health, especially if you're recovering from surgery or dealing with conditions that can disrupt that balance. Okay, and on that note, here's a final thought for everyone listening. Given how complex our bodies are and how interconnected everything is, what other seemingly minor or unexpected things our bodies do might actually be important signals we should maybe pay a bit more attention to?
That's a good question to ponder.
It's just a good reminder, isn't it, to really listen to our bodies and seek out information when something feels a bit off. Thanks for joining us for this deep dive.